Hello, my name is Bertha, and this is my week 9 video. In this video, I'm going to talk about how to do an MRI scan of the knee, ankle, and hip. So the first thing I'm going to do is grab my Inquisition, and then I'm going to check for the patient's information, first and last name, the diagnosis and type of exam I'm going to be doing, and I'm also going to check for the doctor's information and signature. Once I have done that, I'm going to go ahead and demagnetize. I'm going to make sure I don't have any hairpins in my hair or earrings, necklaces, watch. And I'm going to make sure I have my cell phone removed out of my pockets, car keys, wallet. And I'm just going to make sure I have nothing ferrous on my body or on my clothing before I enter zone 4 to set up my scan room. Once I've entered the scanning room, which is zone 4, I'm going to go ahead and put some gloves on, grab some sanitizing wipes, and wipe down the table, the coils, the headphones, and the emergency squeeze ball. So I'm going to just sanitize and clean everything, and I'm going to put fresh linen on the scanning table and lower the table all the way down so that the patient can safely get on. And then I'm going to go ahead and walk out of the scanning room, close the door behind me, and then now I'm ready to go get my patient. And this is what I'll do for each exam that I'm going to be talking about. For the knee, ankle, and hip, I'm going to always make sure that I demagnetize before I enter the scan room and set up the scan room for the patient. Once I have my patient in the scan room, I am going to have them lie down supine feet first. Then I'm going to grab my 8-channel HD coil and place it over their knee. And the landmark is going to be inferior patella apex. So basically, if this were the knee and you go down the patella and right where the knee, the lower part of the knee ends of the patella, that's where you can put your laser. That's your landmark. That's the apex. For the knee axial sequence planning, I'm going to plan my axial on the coronal plane, and then my slice angulation, I'm going to angle parallel to the medial and lateral, how do you say this word? Condyle of the femur. And slice coverage is going to be from the tibia tuberosity up to the line of the superior patella. And I'm going to make sure to include all the tubular joints. For the coronal sequence planning, I'm going to plan the coronal slice on the axial plane, and my slice angulation is going to be angled parallel to the medial and the lateral condyle of the femur. My slice coverage, I'm going to cover from the anterior patella to the line of the popliteal artery. For my sagittal planning sequence, I am going to plan the sagittal on the axial plane, and then my slice angulation, I'm going to angle parallel to the lateral condyle of the femur, and my slice coverage, I'm going to cover from the medial of the lateral condyle. For the MRI of the ankle, I'm going to have my patient lie down supine, feet first, and I'm going to use a chimney coil for that type of exam. And the laser landmark for this exam will be the malleoli of the ankle. For the axial sequence planning, I'm going to plan my axial slice on my coronal plane, and my slice angulation is going to be angled parallel to the Mortise joint. My slice coverage is going to be covered from the tibular joint down to the plantar aspect. For the coronal sequence planning of the ankle, I am going to plan my coronal slice on the axial plane, and in my slice angulation, I'm going to angle perpendicular to the middle and lateral of the malleoli. And in my coverage, I'm going to cover from the Achilles to the tendon to the midfoot. For the sagittal sequence planning of the ankle, I'm going to plan the sagittal slice on the axial plane. And in my slice angulation, I'm going to angle parallel to the medial and lateral malleoli. And my coverage is going to be from the outer aspect of the lateral malleoli of the outer aspect of the medial malleoli. So for an MRI routine hip patient positioning, I'm going to have the patient position supine feet first, and then I'm going to grab my 8-channel abdomen pelvis coil. My landmark is going to be the hip joint. So what I'll do is I'll have the patient bend their knee, and I'm going to look for that crest, and I'm going to make sure my laser landmark is on that hip joint. Also, too, some clinics require us to tie their feet together, so I can use some gauze and just gently wrap their feet and have them together. Some clinics require this because it makes the femoral head anatomically more correct. But again, it's only if they haven't had like a hip fracture or something like that. So for the bilateral coronal sequence planning, I'm going to plan the coronal on the axial plane. And in my slice angulation, I'm going to angle parallel to the left and right femoral head. And my slice coverage, I'm going to cover from the tuberous, oh my gosh, I can't see this. I'm going to cover from the ischial tuberosities to the line of the pelvic symphysis. For the axial sequence planning, I'm going to plan my axial slices on the coronal plane. And in my slice angulation, I'm going to angle parallel left and right of the femoral head. And in my slice coverage, I'm going to cover from the anterior superior iliac spine to the lesser trochanter. For the sagittal sequence planning, I'm going to plan the sagittal slices on the coronal plane. And in my slice angulation, I'm going to angle parallel to the femur. For the coverage, I'm going to cover the hip joint from the outer cortex of the greater trochanter up to the inner portion of the acetabulum. And that concludes my video on how to do an MRI scan of the ankle, hip, and knee.